attempt to do this. Okay, we are recording. So this is our Skype using Zoom platform of our interview with Dr. Christopher Gordon, aka Gordo, my fraternity brother, who is a physical therapist in St. Louis, and I'll kind of let him take over the show. So.
All right. Well, thank you very much there, Tom. It's a pleasure joining you guys here today to kind of talk to you a little bit about what physical therapy is, and to give you a few more details about the different areas that you can go into, and the areas that I specifically have been a part of and have worked in. And I have a little PowerPoint put together here for you, so I'm going to go through a few things with you. Like Tom said, my name is Chris Gordon. I am a doctorate of physical therapy. I'm a physical therapist in St. Louis, and I work for a neurological rehab facility, which means I work a lot with issues like spinal cord injuries, amputees, traumatic brain injuries, and other kind of diseases that affect the brain specifically. So I'm going to go through the PowerPoint here with you guys. So to kind of talk to you a little bit about what a physical therapist is. The first little bullet point there is the specific definition, the more tailored definition that you will hear what a physical therapist does. But in my opinion, put it simply, a physical therapist is someone that helps someone else reach their goals. And that could be, it's a very wide-reaching statement right there, but it could be any kind of goal that you might have. It could be you want to have any more back pain, you'll go see a physical therapist. If you are getting over a spinal cord injury and you can't walk anymore, and your goal is to walk again, you would come see me. So we see people at their lowest of their low, and we try and raise them up. And that's pretty much how I kind of define what a physical therapist does and what a physical therapist is. Excuse me. So what does a physical therapist do? We perform evaluations on different kind of medical issues, ranging the whole span of the medical spectrum there. There are a ton of different areas that you can go into as a physical therapist. Some of the most common ones that you'll find is orthopedics, which would include people that are getting over like an ACL injury, knee injuries, shoulder surgeries, low back surgeries, that kind of thing that is tailored towards anybody that does not have an immediate hospital stay. And they go to the outpatient facilities that you'll see all around the country by differing companies. We also have pediatric physical therapists, and their job is to work with schools and to work with kids that suffer from different kind of milestone deficits, kids that suffer from cerebral palsy or Down syndrome, that kind of those kind of diagnoses, that they get them back to where they need to be, and they kind of work with where their limitations are. Cardiopulmonary physical therapists are those that are tailored towards cardiac patients. Usually if you have a CABG, which is the coronary artery bypass graft, they will go see a physical therapist, specifically a cardio therapist, that will help bring back their breath, their livelihood, their endurance, their stamina, all that kind of stuff you would see a specialist with. And then the last area is the one that I'm actually working in. It's called a neurological physical therapist. And like I said at the beginning, I treat patients that suffer from spinal cord injuries. It could be a traumatic injury. It could be one where they fall off and they sever their spinal cord. Individuals that suffer from amputations, traumatic brain injuries, or anything else that would deal with the neurological system, like Parkinson's disease or multiple sclerosis, ALS, and you can keep naming them, and I've been able to see them. I've worked in both the neuro side of things as well as the orthopedic side of things. And then you might ask yourself, what does a PT do? So we like to have fun, and so we also encourage our patients to have fun as well. Working in a hospital, we see patients that are depressed, sad, and it's our job to kind of get them motivated to get back to their lives and kind of restore where they can go. And I always like to tell patients that we make the impossible possible. So I have seen patients who could not walk due to a spinal cord injury, leaving our hospital walking, and yet sometimes even dancing out. So we like to encourage fun, and we try to make things as functional as possible for them so that they can meet the goals that they want to establish. And just to kind of give you a little bit of an overview regarding PT as a career, the government actually listed us as this 34% job growth between 2014 and 2024. So you are always going to be insured a job no matter what facility you kind of want to get into. We are continuously ranked as the top 10 happiest jobs and the most job satisfaction by Forbes every year. And I am proud to say that I am a physical therapist and I have enjoyed the work that I do. And it is a long journey to become a PT. You have to do 7 years of schooling because it is a doctorate program, but it is well worth the time. Over to you, Big T.
All right. Well, I think one of the things that I think some of us want to know, some students particularly, is how did you get on this path for, getting started specifically for wanting to pursue your physical therapy degree? I mean, that's always kind of one of the things that students always ask is, well, how do I know that physical therapy is for me? So how would you answer that?
Well, I would say this, that whenever I was in school, I took a lot of different routes, as you know. I ended up getting my undergraduate degree in business and worked in business for a while, and it just wasn't for me. I always liked helping people. I was always an advocate of healthy living, and I actually had a couple of bouts where I needed physical therapy for sports injuries, and that's kind of what opened up my eyes about what physical therapy actually is. And it has become just a rewarding career. Not just a job, but a career. And if you are somebody that likes to help people, if you are somebody that is motivated and wants to take on a challenge, physical therapy is something that I would talk to you about ad nauseum. So, but I had my own personal physical therapy injuries that I had to go through, and that's what kind of got me involved.
Okay. So obviously your personal testimony from you specifically having that experience was a pretty good indicator for you. You know, I know I'm a pretty big proponent of physical therapists because I accident this last year. So I know
that's true.
This last year that really do a great job. When planning for a prospective career in your profession, Dr. Gordon, and what are some major concepts or decisions that a student might need to think about as they are starting to plan this process for going to PT school?
I would say just make sure that your heart is in it. PT school takes a lot of time. It takes 7 years. So it's a doctorate program. So you want to make sure that you have a passion for science, number one. Number two, you have to have a good functioning understanding of anatomy because physical therapists have one of the broadest, widest knowledge based on anatomy and the functional system. But I think in order to make sure that physical therapy is for you, definitely make sure you want to shadow. So I would say find a physical therapist out there. They always are welcome to having you guys shadow. But the biggest thing is that it just takes a lot of time. It takes a lot of time and a lot of dedication and a lot of studying. So you just have to be prepared at the get-go that you're going to incorporate at least about 7 years into it.
So obviously 7 years being a pretty substantial amount of time to really get there. So you have to make sure your heart is really in it, right?
That is right.
Sure, you're going through everything. I think also one of the things is, I know you had kind of a course correction for a little bit. So can you talk a little bit how you decided that physical therapy finally was the route to go? I know you mentioned a little bit about having your own personal experience, but I remember your major was not, physical therapy was not on the horizon for you originally.
That is very true. Physical therapy was not anywhere near the horizon that I was on. But the reason why I kind of corrected course was I went into business, and business was just not for me. And I wanted to kind of go into more of helping people. And by me being able to go the physical therapy route is kind of the route that I chose. So I wanted to make sure that I help people. I wanted to be able to help them meet their goals. And in business, I just got tired of you were just a person in a machine kind of a thing. And in PT, you're allowed to kind of be your own person, stay motivated, help other people out. And I always wanted to be a physical therapist around some way, whether in high school I kind of looked at that path and kind of detoured off just because of the schooling aspect of it all. And I just didn't want to dedicate all that time when I was going through my undergrad. But I went out in the real world, did the business thing, and was glad that I decided to go back into PT.
Okay, great. So obviously a kind of a great course correction. We talked a few weeks ago about playing alternate routes, so that's kind of great that you mentioned that. What is one thing about your career that really drives you? Specifically about, everybody has either extrinsic or intrinsic motivators that really get you going. Passionate about what you do, and you kind of mentioned the helping people part, but can you go a little bit more in detail talking about, where does that drive come from? What really was the integral part of having that passion to helping people?
That drive that I have, I see it more as a challenge. So a challenge to myself and a challenge to that patient, because I use it as an indicator. If I see a patient that is unable to walk, I find that as a challenge, and my goal is to be the best physical therapist that I can to get them to be able to walk again. So I see it not only as a challenge to myself, but a challenge to the patient. That's what drives me mostly, is the fact that I don't take no for an answer, or that can't happen.
Okay. So from what I can take is that pretty much you're passionate about what you do, and you like to get to the root of things to help people kind of get back on track for therapy reasons, which is great, aspect to have. So I think one of the things that a lot of people want to know is, I know you started out on a different piece than what you're doing right now in terms of the neurological piece. Can you talk more about specifically kind of where you started with your physical therapy, and then kind of where you are right now, and kind of the major that you see in the day-to-day interaction with people and patients?
Oh, no, definitely. So I started out as an orthopedic outpatient physical therapist, which means that I saw just basic surgeries, knee surgeries, shoulder surgeries, hip surgeries, hip replacements, total joint replacements, that kind of thing. And I did that for about 2 years. And I got to see a lot of interesting cases, but I wanted something where I thought that what I was doing was going to impact their lives in a more grander scale. So if I saw an ACL patient who just had their ACL rebuilt in their knee, we would go through the motions, do the same things over and over again, and every day became kind of like a cookie cutter day for a certain patient. And I wanted to go into a field where you don't just make these little leaps and bounds, but you make strides towards something. And so going from the orthopedic realm to the neurological realm, where patients literally, can't walk or are missing a leg, you are impacting their livelihood more than you would be in the outpatient area. So a 12-year-old kid with a ACL replacement will get over it, as opposed to a 12-year-old or an 18-year-old that got shot and they had their spinal cord severed. And you are teaching them how to walk again. You're teaching them how to stand again. You're teaching them how to move again. It's a vast difference between livelihood and function. So my job now is not to get that 12-year-old back out to the softball field, but is to get that 18-year-old back out of the hospital and just be able to stand and walk again.
So I'd say a big difference between someone who's just coming in for rehabilitated pieces to someone who's actually being able to be totally rehabilitated, going in and be able to have that same independence or same self-advocacy with life management skills. That take for granted, like bathing yourself and, and bending over and picking things up, or making food, those kind of things. So
exactly.
Has there been any particular cases that you've seen specifically that were really just, I guess, out there, that in terms of like things that were really unique that you found that are really interesting, either one with the recovery aspect with people coming out of surgery, the orthopedic piece, currently right now with the neurological aspect?
So I have an interesting case that I had seen, I guess it was about, there's an individual, he was in his 70s, found out that he had a tumor in his neck that was encroaching onto his spinal cord, and they had to go in and remove the tumor. And the higher you go up on the spinal cord, the more affected your limbs get. And the tumor is so bad, they had to cut part of the spinal cord and the tumor out, and so he was left without functioning arms or legs. The doctors gave him a 5% chance of ever regaining motion back in his arms. By the time he left, I worked with him for 6 weeks, I believe. He was walking 10 feet. He was able to push himself up with his arms. He was able to transfer himself in from bed to a chair. He was wheelchair bound mostly, but he was able to make those big strides where you don't see that very often, where you're getting such a grave prognosis from the physician, and they end up doing a complete 180. And he continues to make progress too. I talked to him actually last week, and he continues to walk, keeps getting stronger, and that is what keeps me going, is being able to see those faces, hear those stories, and to actually to know that you're making a difference.
I think that's a good human side that you just mentioned about the human, comparison piece, where you have a face and with a name, that you actually see with the clients, the patients that you've helped. You mentioned the young man who came back and is actually able to function now in life after post-surgery of removal of a tumor. What's one thing, particularly if a student is just now starting to kind of think about that discovery? Maybe physical therapy was never on the radar, but after hearing your talk and discussion about physical therapy and your passion for helping people, what's one thing, if someone's right now as an undergraduate, as they're kind of navigating that career field, maybe they're a sophomore, maybe they're a junior, it could even be a freshman, or they could be a senior in college. Maybe that awakening of physical therapy is just now awakened. What's one or two helpful tidbits and information that you could share with someone along those lines?
I would say this, is that you need to stay open-minded. So since there are a ton of different areas to go into in physical therapy, you just need to kind of do your due diligence and go out there, get some background on it. You can volunteer, get some observation hours at a hospital, at an orthopedic outpatient center, at a skilled nursing facility, a nursing home, and just kind of be awakened to what we do on a daily basis. So I would say that do your due diligence, and if you feel like you have a passion for helping people, pursue that passion. Don't take that for granted, and look deeper into what we do.
I think that's a great aspect to kind of tie into, what you were talking about specifically. Did you have any? You mentioned externship or mentoring or shadowing opportunities. Was there a particular shadowing opportunity that you found really that resonated with you either as a potential future clinician, or prior to you actually getting your feet wet with the actual field in physical therapy?
I did. So my grandma was actually in a nursing home, and I went there and worked with her one day, and I saw how her motion and how her strength has improved so quickly. And I asked her, why she's doing as well as she's doing, why she's standing on her own, walking these great distances, which she hadn't done for years. And she had given me one name, and it was the name of the physical therapist there. And so that kind of intrigued me, and I went down, watched a few of their treatment sessions, and was just kind of amazed and engulfed by all that they can do with the very limited limitations that someone may have when they coming into it. So my grandma definitely got me exposed to it.
Did you, when you were going through clinicals and stuff, is there a particular specialization that you got into, or did you just eventually evolve from the outpatient orthopedic to the neurological aspect? Was there a particular specialization you got that you received, or that you're kind of currently working on?
I did a neuro clinical rotation. I really did enjoy it and really liked it. I always debated between the outpatient and the neuro areas to go into. I did outpatient as a beginning, but I always knew I wanted to get back into neuro. And once I saw the opportunity open itself up, that's when I took it. And so I'm currently working on a special spinal cord certification, where you have to take additional classes, get a certain amount of hours in order to be certified in a specialty like that. But I definitely always wanted to do something with the neuro population. I got back into it.
That's awesome to see that you kind of evolved with your physical therapy, how you started at one point, and then after going through some clinicals and experience, you kind of elevated to another stage. Just kind of exciting, to say the least, about your career development. How it's kind of evolved as a professional, which I always like to see. That's kind of cool. What are some other helpful hints or any other tidbits that you think that somebody else do either right now, this is what they know they want to do, or anything else as they're preparing for jumping right into physical therapy as a potential career?
The only thing that I can say is that just make sure, if you're thinking about this, just do some shadowing. You don't have to do a ton of shadowing. You don't have to go and observe 80 hours of physical therapy or anything like that. Go in to a facility and ask them if they do any observation hours. Pretty much everybody does. Just get involved. When you do an observation hour, or when you're there to help out, follow somebody with a wheelchair. Talk to the patients. These patients can tell you stories that are just the best story you'll ever hear in your life. I have a World War II vet right now that just tells me stories up and down. And just, do your due diligence, like I said, do your research ahead of time. And if it's something that you really want to get into, do some observation. That's the best way you'll ever find out if this is actually truly meant for you.
Awesome. And I know that we talked earlier about sharing your information to potentially answer any additional questions to students that have questions about. I know that you're really good about mentoring young people, about helping them with the profession, which is really cool to see that specifically. So, I think another question that I think some students had, they kind of posed it to me, and I think it's always better to kind of talk to the experts. So, specifically since you're the doctor of physical therapy, you work with a clinical team of physical therapists and OTs, and how does that correlate, and how is it a little bit different?
So we work with, I work with physical therapists, occupational therapists, who are the OTs, and actually speech therapists as well. So the occupational therapists kind of do like the therapy of living. So they work with helping you get dressed. They work with bathing, toileting, that kind of thing, where you cannot survive without the skills that the occupational therapists teach you. Speech therapists teach you how to eat properly or drink properly, or with cognitive issues like memories or even speaking in general. So we all serve as a collaborative team, and we all work together in trying to make sure that the patient is number one, and we are all together creating a plan of care that is addressing their limitations. And we each have our part in the clinical spectrum. And they're all great people. Occupational therapists are some of the toughest ones that I know. And they do some phenomenal work.
Awesome. And I know with you being in St. Louis and you originally doing ortho, did you get to see any professional baseball players or anybody famous?
I did. I unfortunately, because of HIPAA, cannot tell you who I saw, but go Cardinals.
You saw it. Oh, there you go. Go Cardinals. You mentioned it there. That's good. That's good enough for me. Some Cardinals aspects specifically. But once again, I really wanted to thank you so much for taking time out of your busy schedule. I know being a new dad is kind of experience in itself, but to talk to our young people today on our Skype platform using Zoom about what it means to be a physical therapist and the experience and kind of the knowledge that you had to bring to the table being a little more seasoned professional. Once again, on behalf of all of us, we thank you so much, Gordo, for coming today and talking to us. And I'm going to finish up recording here and chat with you for a few minutes, and then we'll call it quits.
All right. Well, thank you very much, Big T. I appreciated being here. And if you ever have any questions, please let me know.
Absolutely. So